Hello, my name is Taylor Jackson, and I'm a caseworker assigned to help address the issues Brody, a 15-year-old adolescent, is currently facing. My role is to support Brody and his family by providing guidance, recommendations, and resources to improve his overall well being and academic performance. Based on the information provided by Brody's mother, she has expressed concerns about what she describes as above and beyond normal teenage disobedience. She is particularly worried about his argumentative behavior at school, his strained relationship with teachers, and his academic struggles despite being intellectually capable. My goal is to address these concerns in a way that provides Brody with the necessary tools to succeed both academically and socially while helping his family navigate this challenging situation. Brody is a 15-year-old male who currently lives with his single mother. His mother has approached me seeking help with Brody's behavior, which has been disruptive to his academic performance. Brody's intellectual abilities are noted to be above average, which indicates that he has the potential for academic success. However, his grades do not reflect his abilities due to difficulty in the following instructions and his tendency to engage in arguments with teachers and school staff. Brody's mother is concerned that his behavior may escalate as he moves forward in his high school years, potentially causing more serious consequences as he interacts with both school staff and his peers. Brody's mother also noticed that there is no history of drug use or any significant behavioral issues outside of the academic setting. This suggests that Brody's difficulties may be more rooted in interpersonal dynamics and emotional regulation rather than substance use or behavioral issues in other environments. It is important to recognize at his age, Brody's at the stage of development where he is testing boundaries, but the intensity of his argumentative behavior raises concerns about deeper underlying issues that are affecting his abilities to interact appropriately with authority figures. Based on the behavioral symptoms described by Brody's mother and the observations regarding his school performance, Brody's situation appears to align with oppositional defiant disorder. ODD is classified under the category of disruptive impulse control and conduct disorders in the Diagnostic and Statistical Manual of Mental Disorders. ODD is characterized by a pattern of defiant, disobedient, and hostile behaviors towards authority figures. The symptoms Brody is exhibiting, including frequent arguments with teachers and other staff, irritability, and difficulty accepting the rules or instructions, are key indicators of this disorder. Children with ODD have difficulty following the expectations of authority figures, which can manifest in a variety of settings, particularly in school. This may explain Brody's academic difficulties despite his intellectual potential. It is important to note that ODD is not just a phase of typical teenage rebellion, but a consistent pattern of behavior that can lead to a more significant challenge if left unaddressed. Without proper intervention, individuals with ODD are at a greater risk for developing further mental issues, including conduct disorders or mood disorders. Brody's situation can be considered moderate in severity. While his argumentative behavior has not yet led to significant disciplinary issues outside of the school environment, the pattern of defiant behavior in an academic setting is concerning. His grades suffer, and his ability to perform positive relationships with teachers and peers is being impacted. If left untreated, these issues could escalate, leading to more severe academic and social difficulties. Some of the specific symptoms Brody is displaying include frequent arguments with authority figures. Brody's tendencies to argue with his teachers and other school staff is a hallmark symptom of ODD. These arguments may be a manifestation of frustration, a need for control, or an inability to manage his emotions appropriately. Defiance of rules and expectations. Brody struggles to follow instructions and adhere to classroom rules, point to a consistent pattern of rule breaking behavior. This may affect not only his academic performance, but also his ability to engage in healthy relationships with authority figures. Low tolerance for frustration. Brody's tendency to become easily annoyed or upset when things do not go his way suggests a low frustration tolerance, a common symptom of ODD. This can make it difficult for him to manage stressful situations, especially in an academic setting where expectations may not always align with his desires. Social isolation or friction with peers. While not mentioned in this scenario, Brody's argumentative nature may affect his interaction with peers as well. Adolescents with ODD often experience difficulties in social situations due to their confrontational behavior, which can lead to further isolation or rejection. Treatment protocols and recommendations. Effective treatment for ODD involves a combination of behavioral therapy, parent training, school intervention, and sometimes medication, depending on the severity of the symptoms and whether there are co-occurring conditions. Based on this scenario, the following treatment approaches are recommended for Brody. Cognitive behavioral therapy is one of the most widely used and effective treatments for ODD. CBT helps individuals recognize and change negative thought patterns and behaviors. For Brody, this could involve identifying triggers that lead to his argumentative behaviors, learning to manage frustration, and developing more positive ways to interact with authority figures. CBT can also address the underlying feelings of anger or resentment that may contribute to his behavior. In therapy, Brody could also learn coping strategies for managing difficult emotions such as deep breathing, self-calming techniques, or finding healthy outlets for his frustrations such as physical exercise or creative expression. Parent training and family therapy. Since Brody's mother has expressed concern about his behavior, parent training will be an essential part of the treatment process. Parent training focuses on teaching parents effective techniques for managing disruptive behavior in children with ODD. This can include strategies such as implementing clear and consistent rules, using positive reinforcement for good behavior, and applying appropriate consequences for defiant actions. Family therapy could also be beneficial to address any family dynamics contributing to Brody's behavior. By improving communication within the family and fostering understanding between Brody and his mother, family therapy can create a more supportive and structured home environment, which can help Brody feel more secure and less likely to act out. School-based interventions. Brody's academic difficulties are a key area of concern. It would be important to collaborate with Brody's school to implement accommodations that can support his learning and behavior. This could involve creating an individualized education plan such as an IEP or a 504 plan to provide additional support in the classroom. This may include modifications like extended time on assignments, a quieter work environment, or access to a mentor who can provide one-on-one guidance during difficult moments. Additionally, working with school staff to ensure consistent expectations across both home and school environments will help Brody understand that his behavior needs to be managed in all settings. Teachers can also be trained to recognize signs of frustration or agitation and use de-escalation techniques to prevent arguments from escalating in school. Social skills training. Brody's difficulties with authority figures may extend to his relationship with peers. Social skills can help Brody develop healthier ways of interacting with others, including conflict resolution, active listening, and managing disagreements. This can help him navigate academic, and social settings with more success. Medication if needed. In some cases, medication may be considered as part of the treatment plan, particularly if Brody's ODD is severe or if there are co-occurring conditions such as attention deficit, hyperactivity disorders such as ADHD or anxiety. Medication can be used to address specific symptoms such as irritability or impulsivity and should be discussed with a psychiatrist. In conclusion, Brody's situation is complex, but with the right combination of therapy, parental support, and academic accommodations, he can learn to manage his behaviors and improve his academic and social interactions. The recommended treatments, including CBT, parent training, school intervention, and social skills training, can help Brody develop the coping skills and emotional regulation necessary for success in school and life. With a continued support, Brody has the potential to overcome these challenges and reach his full potential. As a caseworker, I will continue to provide guidance and resources for Brody and his family throughout this process.